Minister says as many as 60% of South Africans could be infected by the coronavirus. His department says the fatality rate could be anywhere between 1% and 3%, but the current global rate stands at 4.1%. Michael Apple spoke to an expert about what the numbers mean and the potential outcomes for South Africa.
It will ultimately can affect up to 60% of the population. Doesn't mean that they'll all be affected at the same time. Doesn't mean that they will all have a serious illness. It just means that the way the viral infection spread, that is likely to happen.
So, based on what the Health Minister says, let's run the numbers using that 60% prediction.
If you assume the population is 56.7 million, and that's according to 2017 data, that's 31.6 million people. And if you then look at a fatality rate of between 1% and 3% at the top end, at 3%, that's 948,600 people. Does that sound right to you?
Yes, it does. So I think the thing that is uncertain is that percentage around, if the virus becomes so widely spread that it's what we call endemic, basically that it exists in the population. The thing that we don't know is it taps out at some point, It doesn't end up with 100% of the population getting it because of herd immunity. So the band there is quite wide, So the WHO talks about between 40 and 70%. So, it could be 60, but, that's not something that we would know for sure.
I asked Shivani Ranchod what will happen if we, for example, get 10,000 cases requiring hospitalization in the short term.
Is there a tipping point at which our healthcare system simply will not be able to function anymore?
Yeah, so I think what the important way to think about it is the amount of time over which we get those cases. So, absolutely, if we had a spike in the number of cases, most systems in the world can't cope with that volume of seriously ill patients. So it's not so much about our system specifically, but it's a global challenge. Hence this whole kind of flattening the curve idea, because if you have the same amount of cases but you spread them out over, say, 12 to 18 months, it becomes much more doable.
What's the challenge looking at the urban versus rural spread of the virus?
It depends. Our hospital beds are not evenly spread across the country, so it depends on the extent of the spread in different settings. Areas that are closer to our tertiary hospitals have more beds available, very few ICU beds in the more rural parts of South Africa.
Between 80 and 85% of the infected can self-quarantine at home, with about 15% requiring hospitalization. It may seem strange, but Ranchod says what's helping the coronavirus to spread is that it isn't deadly enough. This means there's a need for immediate isolation as soon as you feel unwell.
That's important to understand from sort of a mathematical perspective, is that things that spread quickly but have a high mortality rate actually self-limit faster because people die before they can transmit the virus. What you've got here is actually also not a very even mortality rate. So the mortality rate here amongst young people is incredibly low. It's close to zero at most age bands, and then climbs quite dramatically in the older ages.
Going by the global fatality rate of just over 4%, and assuming 60% of South Africans do become infected, almost 1.3 million people in this country could die. The WHO has noted the symptoms of those who test positive.
It was a study that they did of 56,000 cases. So as is the case in South Africa, when you have applied to the NICD to be tested, the doctor has to complete a form that indicates what symptoms you have. So what that allows is, as people come through as positive, a cross-mapping against symptoms. What we don't yet have statistics or public statistics on are what symptoms South Africans who are testing positive are presenting with.
South Africa has over 200 confirmed cases. How is this number likely to escalate?
At this stage, I would expect to see roughly a doubling of cases every sort of 2.5 days or so. So we would expect by Monday to have sort of 400 or 500 cases. But it's going to be important to see the kind of measures that we're taking will take a few days to filter through into the system. It's not one of those things, because there's a gap between contracting and being symptomatic, and at the moment we're only testing people who are symptomatic.
Ranchard says the private health sector has roughly 40,000 beds, while the public sector has about 85,000. Exact figures on critical care and ICU beds are unknown at the moment. Michael Apple, Johannesburg.